We just gonna stop here talking about the way of hijama and also the benefit of it. We will talk inshallah ta'ala now about the things that are needed to perform hijama and the technique of hijama. We're not gonna take a long time, within maybe 15 minutes, and then we over bi'idhnillah ta'ala. So the things that are needed to perform hijama. So first of the things is the kit for hijama. This one we can buy it with the Chinese medicine and so on. It's around $25, $50, doesn't matter the price. But this is one of the best quality that you can have. If someone wants to do hijama, he should have this in his possession, and then he clean it. And then when the time comes, 17, 19, 21, so then he does the hijama. So it's not something hard, it's something easy. So he has his wife, or the wife has her husband, or her son, or whatever it is, or friends to friend, and so on, sister to sister. So to perform the hijama, which is easy. Inshallah ta'ala, I'm going to show you the cutting, the way to cut, and the way that we do the hijama here in this slideshow. So this is the kit. Here we do those big one, generally on the kahi, which is here in the part. The middle one, we do them in the akhda'ain. And those small one, you can go to akhda'ain, this one, on the back, on the top of the foot. Here, some use it also on the akhda'ain and certain location, on the certain corner of the leg and so on. So, depending on, you cannot use this on the foot, okay? You can use it on top of the head, this on top of the head, and so on. Depending on the location, you choose the cup here. For this device here, for pumping the air, if something gets stuck, you can open it here and then put some Vaseline inside to make it smooth, that movement, and so on. So that's the first material that we need. The second, we need the razor blade. The razor blade, the one that is traditional, which is that it's a square or rectangle. You can buy with this $2, the best quality one, and then you use it. And then we need medical gloves. We need soft tissue paper, alcohol pads, cotton, and antibiotic cream. After you finish, you can put some cream, antibiotic one, you can buy it. And then Vaseline cream. Why? Sometimes you need the Vaseline to get the cup that you need the power to be stuck, especially when the area there is some hair or some curved area. So you put on the edge of the cup some Vaseline, and then you pump, and it will stick in a strong way. So it will facilitate or make easy the job for you. So those are what you call it, the tools or the things that you need to do the hijama. Again, the device of the hijama, the cupping devices, razor blade, which is the most important. The secret here is here. A lot of people get scared from the hijama or from the blood because he said it's painful and so. And depending the way that you cut, it's not painful at all. Sometimes it just it tickle. You feel tickling. Depending on the person that is doing it, you don't feel something hard, pain, okay? Because when you do the cup, you're gonna absorb all the blood in this area, in that area, and then you just take the cup, and then you're gonna do small cut with a 45-degree angle. The razor, you take it, not too deep, 2 millimeters down, and then you go picking like this. That's the opening. Again, 45 degree, and then you make some small cuts of around like half centimeter or less. And then you can do many, 12, 11, depending on the circle. It'll be red or purple. So then you do it, and then immediately you're gonna put the cup, and you do that absorption of the air again, and the blood will come out. Okay, that's the way of do the hijama. Now here, as we're going to see, the certain location of the hijama that Rasulullah did, and then we talked about it before. So this is the hijama on al-kahin. That picture here, you see al-hijama on the kahin. You see the cup? We put the cup first here. That kahin is the area, as we said, the scholar said it's the area that is used for general health for your body, to cure all the sickness that are in the body. Al-akhda'in, this is the place of al-akhda'in. Okay, so this is al-kahin. You go from the end of the hand with forefinger, and then you put the, what do you call it? The finger here. The finger here, so this is the big nut anyway, but you put like forefinger or around 5 finger. From that distance, your hand will arrive here, and then you put the cup. You put the cup here, you create that depression inside. After 5 minutes, you take away the blood, you take away the cup, and then you take the razor blade and you cut in an angle of 45 degrees. You take the razor blade, you leave only 2 millimeters or less in your hands, and then you pick like this. And then you do all the area that is red or purple because of the blood, we work in that, and then you do it. You see some drop of blood coming out, then you're going to put, you work easy. It's not something that you're going to see the blood coming strong. No, it's easy, it's normal. And then you're going to put the cup, and then you pump again, you take away the blood, you leave it for 10 minutes, and then till the cup will be full of blood, half depending on the person. Some people, especially the youth, they have the blood that is very light. The people who are very old and they don't exercise, maybe you see no blood. So you need to go again, maybe big cut and so. But for the people who, normal people, so you can have half of the cup. You do that, and then you put a tissue paper at the bottom, and then you reverse the cup. You make a depression here. You push this, you pull this, and then the air will go in, and then you take away the cup, and you clean. Okay, but the tissue paper again, and then you wipe it again. You clean it. You take the blood. You throw it in the sink water, and you let it go. Some bid'ah, he said you have to bury it on the ground, and so those is not authentic hadith. Okay, and what do? You clean it again with the tissue paper. That is soft and clean, and then you put again the cup. If you want to do it for 2 times, 3 times, especially we need to follow the odd number. Okay, 3 times, depending on the person. You can take 2 cups, 3 cups. Okay, if the blood is coming out, so you can take 3 half cup, and then you finish the hijama here. You want to do the hijama on the akhda'in here. The hijama on the akhda'in, someone need to be having experience. Why? Because just under the skin, you have a big vein coming down here from the head, okay, and going down to the chest, which is the lungs and the liver. So here, someone has to do it very careful, not to avoid that vein. You should avoid the vein, the area of the vein. And then he does it here, in this part and in the other side. Okay, so this is the way that we make the hijama on the kahin and akhda'in. This one and the other one. So those are the locations where Rasulullah did the hijama on them. The next, which is al-akhda'in. This is al-hijama in al-akhda'in. As we see, you see, those cups are big. These are big, very big. So you can use the medium one, the middle one. The cups that are middle, as I said, the cutting has to be for the one who has experience. Why? Because there is pain coming, and then you can cause damage to that person. And if he does it here, I have to say that here in Canada, there is no doctor that is permissible for him to do cutting of the skin outside of his clinic. So if he does that, he will take away his license. He's not going to be a doctor anymore. So they are very tough here in Ontario. In England, they have no problem. There is association. There is England, which is in Britain. So they have that hijama. People specialize in the hijama. Of course, this guy here is in the Middle East, in a Muslim country, Arab country. So that's the hijama in the akhda'i. Okay, and then we mention about the benefit of this hijama in that location. This is the hijama on what you call on the top of the head, which is, I want to ask you, al-hama, what else? What Rasul used to call this? Al-munqida or Ummu Maghith. Okay, the savior. So that's al-hijama on the head. And believe me, if you never did hijama, it's better for you to try this first. You will see clear, you will start seeing clear, you will hear clear. And the first time, because I tried it, I heard, I saw, and then subhanAllah. Because all the blood that is right here on the head, you're going to take it, which is the bad one, of course, you're going to regenerate with the new blood. So that's what we call what you're going to see clear, and then even the things. That the effect of hijama. So this is the hijama on the head, on top of the head, or Allah call it Ummu Maghith. And this is good for shaqiqa, is good also for headache, is good for the eyes, and also all the sicknesses that are in the head. This is the hijama on top of the foot. As we said, our Sunnah did it. Here we have to be very careful also. Here we have to be very careful. We said this type of hijama, as we mentioned the saying of Ibn Qayyim alayhi rahmatullah, he said this is good for the diseases that are in the leg, for a woman that has on the problem with menopause, for the things that is the lower part of the body. So the hijama is good, as Ibn Qayyim said alayhi rahmatullah. Here we have to know that in those locations we have a big vein, like here, the vein that we see here, and on top of our foot here. Someone who does hijama here, you have to be very careful. If you touch the vein and then you cut it, so you are in problem. So that's why the cut has to be very small, like here, around here. And then the big vein that comes from the leg, it comes and turns like this. If we see the human being, what they call it, vein, and you can see someone who studied medicine, it goes like this, and then it collects all the blood that comes from the big vein. So that's why he said that it will be replacing taking, if you take blood from here, it's like you take blood from the big vein that is in the leg, which is al-fasl from the big leg. So this is hijama on the foot. Allah did, because of the sprain that he has it on his work, as we said it last time. So this is mostly the end of our presentation, but I have to explain